This video presentation is about the importance of interprofessional communication for emerging paramedic students. It follows the Gibbs cycle of reflection in order to reflect on my experiences this far. Communication within the paramedic career is very important. Not only do paramedics communicate with their patients constantly to gain an understanding of what the patient's ailment is, they also have to communicate to reassure the patient and make them feel comfortable. Further, paramedics communicate with each other, dispatch centres, as well as other emergency services in order to safely and effectively treat patients. On arrival to hospital, paramedics also have to communicate to the triage nurse and the multidisciplinary teams in a concise manner that relays all the information necessary for the patient. This handover is a legal handover of responsibility from the paramedic to the hospital staff. Patient treatment and diagnostic testing are often decided based on aspects of handover from paramedic staff. Finally, the clinical documentation of cases is yet another form of communication that paramedics must do in order to record a detailed and accurate list of events. Communication, both verbal and written, is intertwined in the day-to-day work of paramedics and therefore needs to be done well. It is also then important for students to undergo training and practice of these methods of communication in order to be ready for the career that lies ahead. As a paramedic student in my final year of placement, I have seen firsthand the importance of effective communication. Learning to communicate with patients to obtain history and symptoms can be very difficult. Each patient is different in the way they communicate, how forthcoming they are with information, as well as their own understanding of their symptoms. Further, age, culture, and disability make communication with patients even more challenging. This makes communication challenging in some cases and calls for higher level of skill in communication. On placement, I find it very advantageous to be able to communicate with a variety of people, as well as see professional paramedics communicate with patients in a manner that eases the patient while at the same time obtaining information needed for diagnosis or treatment. Perhaps the most challenging form of communication as a student is the handover at emergency department to the triage nurse. It can be difficult in the busy environment and many people around for novices such as myself to give a good handover with all the information needed. Documentation is another form of communication that is important for students to learn during training. I personally find it much easier to write down the handover as I have time to reread and edit it as necessary. Further, by having a go at the documentation independently, then having my mentor check it, I find I can learn a lot from my mentors regarding pertinent negatives and the legalities of treating patients. Often documentation and handover are great teaching prompts where I am reminded to ask for clarification about cases that I wasn't sure about. Overall, I feel my communication has improved greatly throughout my study. However, I feel that it can continue to improve with experience when I begin practicing full-time. Having worked in the healthcare field for 6 years already, I am confident in my ability to communicate with patients effectively and build a professional relationship with my patients. This placement, I have had many more pediatric patients than before, which has helped me to learn how to communicate with children in a more effective way, as well as assess them using non-invasive techniques. Further, learning to communicate with my mentors during jobs has been advantageous this placement, as we have had busy jobs which require all of us doing jobs and updating each other constantly. Learning to listen to information and put it all together is quite challenging and is an area of communication that I can continue to improve on. As mentioned, I have worked in the healthcare industry for 6 years now, and I feel confident in communicating with nurses and doctors. However, in the setting of the emergency department, it can be very difficult to get a full and effective handover done. By using the acronym AMIST-AMBO, I feel more confident that my handovers include all the necessary information. However, sometimes I don't have time to write notes for handover, and therefore I make it up as I go. This often results in me forgetting something or the handover being disjointed. Further, sometimes the receiver of the handover will cut me off before I complete the full handover, which makes me feel like I did not get all the information that would have been necessary for patient care. I feel quite confident in my ability to document appropriately due to the amount of practice I have gotten over my last 2 placements. I've had mentors who allow me to do the paperwork and then adjust it before finalising it. By allowing me to do the documentation, I feel that they trust me, and I am often complimented in how thoroughly I complete good paperwork. Although it isn't perfect, I feel like documentation is one of my strengths of communication. The communication between qualified paramedics and nurses at the emergency department is a well-known area for communication failure. Yet, in the emergency department, triage, resuscitation, and interventions are often based on information provided by paramedics, according to the Evans et al. 2010 study. Further, Stowe et al. Reports poor communication impacts the continuity of care and can cause adverse effects to patient safety. The Dodgme study in 2014 identified that poor communication between pre-hospital and hospital staff was a major area for improvement and highlighted the key problems. These problems include a lack of communication standard, no formal transfer of responsibility of patient care, and inconsistent information carried on by every professional group examined. Handovers are complicated by the busy and loud environment in ED, the lack of time for handover, and the lack of resources, according to Wood et al. 2015. Further, communication breaks down due to not listening, not trusting, and misunderstandings between staff. Handover is also complicated by differences in clinical duties and professional culture, overlapping sites of work, communication errors, and teamwork conflicts which can be detrimental to patient, as found by Kalani et al. 2017. Handover is often performed in high-pressure environments, and a study by Evan et al. Found that only 34% of information verbalized by emergency staff was recalled by ED staff. It is suggested that handovers be succinct, structured, and only contain the vital data for immediate treatment. Handover should be done in an appropriate environment with appropriate manpower, adequate equipment, and the clarifying expectations will improve handover, according to Kalani et al. 2017. Many studies have found that a structured format for handover reduces missed information between pre-hospital and hospital staff. I-MIST AMBO is one of the preferred structures, which has been found to improve the amount of information relayed, reduce repetition, reduce handover time, and any further questions from nurses, as stated by Edimar et al. 2012. It is suggested that improving handover techniques through structured handovers improves comprehension and retention of handover information. The Dodgme study also identified the use of structured communication tool ISBAR to assist with improving communication. The use of structured handover tools such as ISBAR is recognized to help clear and complete transfer of information, according to the Dawson, King and Grantham 2013 study. Difficulties in communication are even more common among graduates and students. Graduates commonly lack communication skills as they have minimal interaction with other health professionals during their study, as stated by Poor, Cullen and Scar 2014. The use of interprofessional education for students to learn to communicate effectively and work collaboratively is recommended by Stowe et al. During training 2017. A study conducted by Reeves et al. In 2013 showed that interprofessional education improves interprofessional collaboration and patient care in the emergency department. Another factor affecting the development of communication skills in students is the fact that many students are not given the opportunity to hand over in situations where multiple teams are present. Handover is critical for patient safety and can be made difficult due to the different professional languages between different treating teams, according to Stowe et al. 2017. Ho et al. State that the multidisciplinary nature of healthcare makes communication even more challenging. By allowing and encouraging junior staff and students to hand over, it will build confidence as well as give experience, according to Dawson, King and Grantham 2013. Another way to overcome challenges in communication between multidisciplinary teams is the written communication in the form of documentation, as found by Ho et al. 2014. Documentation serves 5 main purposes: clinical, administrative, legal, research, and education. Teams within the healthcare setting have very different ways to communicate. However, documentation is available to all teams and can improve communication, according to Judge Me 2014. As a paramedic student, it is very common to struggle with communication in all forms, as even professional practitioners have difficulty communicating effectively. The emergency department is a very busy and loud environment where information is often missed during handover. Through the reflection of my experiences with communication and handover, I have identified my strengths in written communication and the need to improve my oral handover techniques. I have achieved my learning goals of effectively applying oral and written communication to facilitate ongoing health care. I have also critically reviewed, analysed, consolidated and synthesised knowledge and skills in the application of evidence-based patient care. Finally, I have critically discussed the growth of self, student to novice practitioner, my career path options, and the social responsibilities of a practicing paramedic and team member as part of my ongoing learning goals. During practice, I can continue to take opportunities to communicate with patients, hand over to triage nurses or multidisciplinary teams, and complete documentation for cases. To continue to improve my communication techniques, I can use handover structures such as AMIST AMBO or ISBAR to ensure my handover contains all necessary information. As well as that, continue to improve my written documentation through constant reflecting of my technique and asking professionals around me for their input on my documentation.